Uh, all right, we are now live. Hi, everybody. It's Katie Harris, and we are doing the inner game. And today we got Jill Weberding, as usual. And
Hello.
we brought in Brad Ferris. Hi, Brad.
Hello, my first time.
So today, we brought Brad about inner game and mindset and what you need to do. And Brad and I had a really great conversation, and I wanted to introduce him to Jill and all of you guys about what he calls transactional conversations. Brad, why don't you give us like a 2-second overview of you, and then let's talk about transactional conversations.
Yeah. So registered nurse, not unlike probably a lot of individuals viewing. Spent 10 years at the bedside doing clinical practice. Thought that I was doing amazing patient care all of the time because that's what the organizations told us we were doing. Had the opportunity to go and do my practice in private practices and realized there was this whole other world of conversations that we were not having inside institutions with our patients. And even when I went back to working at the bedside inside of the hospital, I really felt like I was on a different planet, that the conversations I was having out in private practice should have been happening inside institutions. And there was really this culture shock for me of coming back to it of why is not everyone having this type of conversation with their patient? And ultimately, my wife was like, you're not happy, go and do this for your career. And that's where we started our marketing agency.
Awesome. All right. So tell us a little bit about transactional conversations in everyday clinic life and why they're not helping businesses.
So I'll give a perfect example. I would challenge any of us to do this tomorrow. It's certainly something that you probably don't even recognize it, but it happens. Pick a dentist, pick a chiropractor, pick anybody out of the phone book that you want to, and just call them up. You're not a patient. Just call them up and express that you're a new interested patient in their services, and count how many seconds it takes until they ask you the question, "What's your insurance?" And no, honestly, it's a really humbling experience for each of us because we have to recognize that that's a transactional conversation. It's not about, hi, how are you? It's not about, how can I help you? It's not about the services that we're excellent at doing and what we excel at in terms of patient care. It's, are you a fit transactionally for this practice or are you not? And when we go into the hospital, it's the exact same thing, even in pre-admission. What's your insurance? Right? What's your health information? Not how are you feeling? Not, do you have all the resources that you need? Does your family know where you are? It's really when you're out in private practice, that becomes everything that you do. That's what makes your business successful. Inside our large healthcare institutions, we've gotten really lazy and we're really bad at customer care. And that translates directly to our patient care.
Yeah, it's kind of like, hi, how much of my time are you going to waste before I figure out if I need to direct you somewhere else?
Yeah. And unfortunately, that does bleed very much into how, as healthcare professionals, we develop our conversations with our patients. And we have to be cognizant of, even if that conversation is away at an administrative level, we then see that patient next and often go right into transactions. What are your symptoms? What's your history? What are your medications? Not again, hi, how are you? How can I help you today? What's the struggle that you need me to address? I'm going to do my assessment. I can do my ABCs just by looking at you, but I need to treat you as a real person.
All right. Yeah, and we even teach our nursing students and nurse practitioner students, the patient oftentimes will go kind of like off the rails and start talking about stuff that's irrelevant, and you got to bring them back to the symptoms and bring them back to exactly what you're talking about, and it carries over into private practice, it carries over into our businesses and our just everyday lives. Jill, what do you think of that?
Absolutely. Ironically, I recorded a video about transactional care, which is what I think, we're in a transactional care system, healthcare system right now. And it's very much, with exactly what you're saying, all these current systems that we're using, EMRs that make no clinical sense and that, end up pulling pulling us further away from patient care, which is the whole reason we're there to begin with. It is about the bottom line. It's about productivity ratios and staffing ratios. And, it's all about, it's become a game of accounting, whether you're in the hospital or outpatient clinic. And that by nature is accounting. And that is not health and wellness, which is what we're supposed to be in the business of.
Right. And that was, kind of the feature. And I didn't have the words, I think, when I first started Nursepreneurs to say, this is what I want nurses to do, is to have these more, like Brad calls them, empathetic or therapeutic conversations with the clients. And I'm not talking about like hospital patients. I'm talking about nurses in business helping people that are clients and helping them in a very warm, therapeutic way, and not okay, how many pounds do you want to lose, and blah 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 blah, and go through that checklist of things that you're going to do. And it differentiates us as nurses to do something like that.
Absolutely. I mean, I think, Brad, I love your example of just like for once, sit on the other side of the table. Like, just first thing first, pick up the phone and you be the patient for once and hear what that sounds like. Because I think, we are, in the day-to-day grind and asking the list of questions on their, admission history, or, automatically asking everybody, are they a DNR? Do they have, a living will? And like, I'm in the world of oncology. So when you say that to a cancer patient, they're like, what do you know? Like, do you know? What do you mean? Like, and for somebody who's not seriously ill, they have the same, kind of visceral reaction. Like, why would I need that? Is there something, do you think I'm really sick? Versus, oh, we ask that of everybody, but we don't have the conversation of, now I'm going to ask you some questions. This is really important to make sure that you always have your wishes carried out. Do you have you gone through this process versus do you checklist.
Yeah, absolutely. So Brad, what are some of the things that you're teaching in terms of how we don't be so transactional?
Honestly, it's using our strengths and getting back to who we are as nurses, right? So we're exceptionally trusted, we're exceptionally respected. And when we put our first foot forward on that transactional sense, we're almost losing the patient's interest right away. So I was kind of sharing with Catie, even on a sales approach, when I teach my sales team to go out and I teach them exactly as I would do it as a nurse, which is ask the important questions, use your emotional intelligence, disarm that individual from thinking this is a transactional conversation, and really get into the mode of, what is it that I can do that can help you today? Are you interested in this help? What's holding you back from doing the things that you want to do? They're all very important clinical questions. We're experts at asking these questions, but we don't do them when we take our scrubs off or when we take our ID badge off, right? We get right back into the same mode as everybody else. And what I'm trying to teach a lot of my team to do is, no, this is a strength every day, 24/7, live, breathe, have that identity that as a nurse, you have this really unique skill set that helps you create relationships with endless numbers of people.
Yeah, and Jill, I mean, how many times have we worked with our nurses and they'll say, they hate sales, and really sales is asking somebody how they're doing
Yeah.
and, finding a solution for them that would help them. I mean, that's sales.
Absolutely. I'm always like, oh, good. I don't like sales either. I'm not in the business of sales. I'm in the business of helping others. And there will be some people who need my help and other people who won't. And I'm happy to serve those who need it. And I'm going to, put it out there to make sure that those who do need it know that I'm available, right? And that I have the skill set to give them a solution.
Yeah, I think, from a mindset perspective, we kind of think of sales as a way to get something from somebody as opposed to give somebody something that they need. And that's definitely a mindset shift that, we need to address.
Well, my mindset, if I can interject, is everybody's in sales. We're trying to convince our patients all the time to follow the treatment plan, to take the medications, to give us the information we need on the assessment, right? It's just, again, it's a mindset shift of, I'm not having a transactional conversation with somebody. I'm having an investment conversation in their health or in my business or in the products and services that I'm trying to promote in my nursing business. There's nothing wrong with sales. If anything, you should embrace it. Because again, we're very influential in the engagements and the interactions and relationships that we have. Use that as an asset rather than using it as a liability.
Absolutely. That's a great perspective. Yeah, I love it.
Yeah, no, I love that too, because it's something that we need to help the nurses change that mindset, that they're, because I think like when you get money, there's that kind of mindset, mastery over money as well. Like you feel like you've taken something from somebody as opposed to given them something. But I think when you approach sales and business in a way that you're really helping them, and if you use this more empathetic, therapeutic approach to helping them, you can feel good about yourself and feel good about what you've done. And Jill, I think that's why we always tell the students and our nurses that they need to be in something that they love to do, because
Right.
we're not trying to hawk products, we're not trying to hack services or whatever it is that, we associate business with. We're genuinely trying to help.
Right. And maybe that is exactly, Brad, what you were saying about the mindset shift of everything is sales versus we view sales as car salesman sales, right? As like stereotypical.
No offense to car salesmen.
Slimy, no offense. I'm so sorry. I don't mean to offend, but this negative stereotype of you're taking advantage of, there's always a winner and a loser versus a mutual win, right? In the relationship that you're building, right?
One of the most powerful things I've taught my team on sales is we don't answer the question on price anymore. We don't even use the term price. We term it as an investment. So if someone says, what's the price? We say the investment for the following outcome is the following. And again, it's being mindful of price is a transaction. An investment is what are you providing to me that I'm providing in return? It's reciprocal, right? And again, it's when it gets back into nursing, you can see everything that I do takes on that persona of the nurse because that's where we're best suited. That's what we're excellent at doing, is being nurses.
Yeah.
I love how you're living and breathing that.
Yeah.
Right? I mean, that makes all the difference, truthfully. Yeah. So that's it's a great mind shift to bring to everybody.
Yeah, and it's an incredible strength of nurses because I mean, and I think part of this, maybe the mindset or the mentality where we don't like sales is tied to the fact that we don't generate money per patient transaction. So, we kind of, I don't know.
For ourselves.
Yeah. I mean, we obviously get a salary to work because we need to eat, but it's that same kind of concept in business. But now you are taking money from somebody, but it is an investment, and it's not only an investment that you can make if that money's coming in, and you can meet Maslow's hierarchy of needs, right? So you do have to accept the money and know that what you're doing is worth what you're being given.
And a big struggle is, I mean, inside institutions, we are crushed on the value perspective, right? We very much feel devalued on the work that we do. And out in the entrepreneurial side, that's a hard when you're suppressed for so long, it's really hard to suddenly think to yourself, I am worth it. My services are worth it. My products that I'm providing are worth it, because everyone has told you that your overtime didn't matter, right? That the excellent care that you did, right? We have all these people in leadership positions that are not clinical individuals. They're not even regulated healthcare professional, and they're providing us reviews on what we should be doing or not doing, not knowing the first thing about clinical matters. And all of that, whether it's a 2-year period or a 20-year period, it really does push us down, and it kind of cracks our confidence. And when I'm talking to people all the time, I'm like, no, like you have more skills than most salespeople have. You're just not utilizing them effectively.
Oh, I love that.
Yeah, we did. We've got a group right now that we're working, on with nurses building courses, and that was a huge issue through the whole process of all these nurses who have been giving these services, this knowledge, these skills for free for, like you said, many of them for years, and doing it willingly and loving it. But now they're trying to transition and recognize that value and do it on their own terms outside of their organization. And they really are struggling with that mindset shift of, owning, and recognizing the value of what they do and the knowledge and experience that they have, right? So it is a big transition for a lot of nurses, at least in the beginning, for certain.
Yeah, no, absolutely. Yeah. So, what else, Brad? What else? So I know one of the things that. What's that?
We can talk all day.
I know. Actually, one of the Jill and I was telling Jill about you after I had that conversation with you, and I said, what was really interesting about Brad is that Brad has created this AI, or this artificial intelligence, to help with the therapeutic conversations, and you didn't know any coding, you didn't know anything about AI. And I said to Jill, what I really liked about Brad is that he had the audacity to go figure it out and start a business on it. That was so like bold and brazen. And the question that I want to ask you, that's a little offbeat, but now that you're here, is like, why did you think that you could solve this problem and not just, wait for somebody else to come in and do it? Because you had to teach yourself everything.
Yeah, but I think it's having, again, I came out of that weight, that crushing of an institution, never feeling like I was wrong, right? It's literally like a year tomorrow was the conversation I had with that old boss that was like, no, like there's not a market for this. Like this doesn't make any sense. You're never going to be successful. And I remember coming home and looking at my wife and she's like, aren't you upset? And I'm like, no, like I feel free. Like I feel like I'm going to go out and I'm going to show everybody that's ever put a nurse down how we talk to our patients, how we talk to people, how we do our job. I mean, that's the wave of the future. You want to talk about customer service, we are your customer service experts. Like that's what we do. And it was just also too, like I shared in the interview on the podcast, looking at all of these AIs, the first time my wife walked in the room, she was like, why are you talking to it like an idiot? She's like, you don't talk to it. You don't talk like that. And I said, well, what do you mean? She's like, talk to it like you talk like a nurse. And as soon it was a little epiphany because I was like, you're right. What do nurses do? We use a ton of gratitude. We're one of the few professions that say thanks almost too much, almost like a Canadian, right? We say thank you a little too much like a Canadian. But it's really unique about who we are as a profession because why? Well, we value the time that people provide to us. We value, that relationship, right? And the nurses that burn out, they still have that fire. It's just, again, it's been suppressed, right? So when I started this journey, it really was thinking of myself, like if I could take my one conversation in a minute with a patient and express that out into 200 conversations in a day, but continue to scale that even farther, what's the impact it could have? Yeah. What's the impact it could have to a dental practice, to a cosmetic practice, to IV hydration? Like when patients are talked to that way, they transition to talking to you just like a nurse. And they're like, oh yeah, I want to learn about this. They engage at such a higher level than the regular sales process or the regular customer service because they don't realize they're talking to the nurse, but it's the same conversation they have with a nurse. And it makes sense. Like when we walk into the room and someone's eyes light up because we're their favorite person, the exact same feeling that they get when they talk to the AI.
Yeah. No, it's interesting because it does change you because, when there's that white coat effect too. Like when the doctor, the provider walks in and they start like shooting transactional, you tense up, right? Like I do anyway. Like the first thing to do is my shoulders get tight and they'll start asking, what's your insurance? What's this? What's that? What symptoms do you have? Tell me about your deepest, darkest thoughts. And you're like, and it's just kind of like, no, I'm not comfortable here. So.
Yeah. So for me, I just had this mindset of we've been silent for far too long. Or we haven't been heard for far too long. And I wanted to go out there and just be like stamp, like I'm done with it. I'm done with it. I'm not willing to, even in a mindset perspective, accept it anymore. I've had sales coaches tell me that what I'm doing is amazing, the reason why, and they kind of copy some things off of that because again, it makes sense. Why would every salesperson should go to nursing school.
I actually have like a video about that. I totally agree. Or, I actually might had a twist on that entrepreneurs should go to nursing school to learn how, to solve problems and that kind of stuff. I love it. We've all been thinking in tandem. And Brad, I had a similar situation because I did feel the crushing weight of the hospital, but it did like knock me down quite a bit. And it took me years to really just kind of build myself back up and going through all kinds of mindset journeys and that kind of stuff, because it did, the weight of the hospital just for 20 years just being crushed. And the transactional conversations that we have, not just with our patients but with each other as well, like the higher medical hierarchy, and not feeling valued. It was just, yeah, I mean, wow. It's a lot, there's a lot to unpack there.
Yeah, I think what you still seem to have like kind of glossed over, like it's no big deal that you've done, Brad, is that like you had to go out and learn programming to do this. Like not only did you have this fantastic idea that just makes sense in every sense of the word to have these conversations, and because nobody was doing it, you're like, well, obviously this is what we should be doing. And since no one's doing it, I'm going to make it happen. Versus a lot of nurses that we see are like, well, that would be, I have this great idea, but I don't know how to do X, Y, Z. Like you could have easily been stopped and hindered by just saying, that'd be great if I was a programmer, but I don't, know how to do that. You actually said, I can do hard things. Like, why wouldn't I? This is so important that I need to bring this to fruition. I need to bring this to the world because it is going to increase, have such an impact on so many people. Like there's a burden to not move forward almost, right?
Yeah. No, I'll put the little asterisks because I don't know how many people know my full background, but I did business grad school before I did nursing. So the opportunity I had was a lot of the skills, a lot of the mindset I already had from business school, probably that kind of to a large degree shaped my ambition too. When I would walk into a hospital, I was already the outsider, right? Like I was a nurse, but I was already, this was my second career, right? This was something that, everyone was like, well, he's going to go and do leadership at some point. He's only here for a temporary period of time. And I ended up falling in love with the patients. But that struggle I'm sure lots of nurses could have done it, but I also am very mindful of, my experiences that I've had in business. It was a very logical step for me to take the day after I left that job of saying, okay, like this is what I'm going to go do. And if it's not successful, I understand there's a high chance that it's going to fail, but I don't fear failure.
Right. I love that. And that's, this is the channel your Sarah Blakely. Like, if you haven't failed today, why did you get out of bed? Like, you're not pushing hard enough. Like, we're going to celebrate failure so much that it is, it's like a negative if you don't, as opposed to the opposite. So I love that.
Yeah, and it's just about the experience that you have, and what else can I learn? And that was one of the things that was a driving force for me in Nursepreneurs, which actually started out as a blog, and I didn't know how to write a blog, so I had to go learn that skill set. And then it was like, okay, well, now I don't know how to get this blog in front of the right people, and then I don't know how to do this, and I don't know how to do that, and you just keep pushing and pushing and pushing, and you get to a point where you just have learned so much. And now, Jill, when we talk to our group sometimes, I say things like everybody knows them, like, oh, you got to do this SEO or set up your email service provider and blah, blah, blah. And they're like, wait, what? They don't, yeah. So you take for granted that the skill set that you've learned. But that's the one thing that I love about business is just, it's such, there is no end to the learning. There is no end to what you could possibly learn. And you could just keep growing, which is one thing I didn't get in the hospital. Like every time I came to the hospiel and be like, well, let's do this. No, let's do that. No, stay in your lane. Don't.
You're thinking too fast is what I was told all the time.
Yeah.
Right? Your ideas are, you gotta wait in line. I'm like, yeah, but I can fix that problem like today. And they'd be like, oh, no, it's got to go to, this committee.
Yeah.
And we're going to have a committee. 3 committees before we can even vote on that. Like, what?
Yeah, that's the beauty of small business, because you can pivot and turn. And that's one of the things that I have. I have a couple programs that I'm beta testing, and if I don't like it or it's not going to make money, I'm going to just chop it, and we're going to keep moving.
Move on.
Onward. Move on. Yeah, right? Exactly.
I think it's really important to keep showcasing, the Brads and the nurses out there who are doing all these different business type of, entrepreneurial things, because it helps us realize, and that's kind of my big mission I've come to realize, is that we need to really expand the vision of nursing, right? It goes so far beyond the bedside. And when you start actually taking your nursing skills and putting it in aligning with what your passion, what you really want to do, the impact you want to make, that's where the magic is, right? And so we've kind of we've shied away from being on stage and being in the spotlight. We haven't had, some of these prominent leadership roles. And so, that it kind of reinforces that that's not our place to do that. But as we see more nurses who are stepping out and doing these kinds of things, creating amazing products and companies and, changes in healthcare and how people are viewed, like that is really, I think, what becomes the aha for the profession of kind of raising all of us up to say, nursing is everywhere. Like, I can't think of a more versatile career that you could pick and to work with every possible, population or in any kind of, venue that you want to, anything you dream, essentially, your nursing skills will fit right into that.
Right. And I would say, just kind of, to piggyback off that and highlight kind of what Brad is saying, I think that this is our opportunity to stop looking to the institution to fix things, stop looking to other people to fix things. Like, if you see a problem, it's on you to do something like that. We need to take that ownership, that it's something that we can do with the right team in place or the right people by your side, or maybe you just need a little bit more information and you want to learn how to code AI bots or something. If that's a little hurdle that you have to overcome, then fine. But it's on you, and we need to stop asking other people to fix what we see wrong and step up to it ourselves. All right, guys.
I'm waiting for it to happen. Don't stop waiting. You get out there and do it, right?
Yep, absolutely. All right, why don't we each that was my final thoughts, but why don't you two give your final thoughts?
Go ahead, Brad. You're the guest.
I just love sharing. My hope is, anything that I ever share helps somebody else to get motivated, to get past that hurdle that maybe they don't quite have the confidence or knowledge or experience to do. And that's, we're all afraid when we did our first couple of IVs, but we never failed our first one and said, I'm never going to do that again. You persevere and you go grab more knowledge. And again, I think, a lot of what we've talked about here is just look at yourself, look at your career, your education as this massive asset rather than any type of liability. And I think you're going to be very successful.
Absolutely. I love it. That's my final thought. I love it.
That's your final thought.
Just if you could come into the knowing of what you are in possession of, right? Of your skill set and, the empathy, the relationship skills that you have, and probably that you partly brought to, that's maybe what pushed you towards, drawn you to nursing, is you have that inside of you already. And then it was just fostered with all your relationship and, all your experience with patients. Like that, you can take that as far as you want it to go, and I love, the bedside is great, but it's not for everybody, and if you're going to stay in the bedside, make sure your voice is heard and you do keep coming back to your leadership and saying, we need to solve this problem. We need to solve this problem. And here's the solution. Don't let your voice go unheard. That's where burnout, I'm a firm believer that that's actually what burnout is. You can call it what you want. It's misalignment is what it is. It's misalignment with our core values and our passion to serve the patients, and that it's become transactional healthcare.
Yep. And I would say it's my final thought is that, you know, since you are burnt out and you're feeling the crushing weight of the hospital system, there is an alternative. So come talk to us. Come talk to us on this. Or you come to Nursepreneurs. Brad's at Clinic Grower. Jill's at Nurse Assure, and we'll put all our information in the notes. But there is opportunity for you out there, and we need your knowledge more than anything. So, all right, everybody. Thank you so much.
Thank you.
Thank you.